negotiability of second mesobuccal canals in maxillary molars using reciprocating system. The aim of this prospective clinical study was to assess the frequency in which reciproc 25 instrument is able to scout and reach the working length in MB2 canals from maxillary molars compared to the conventional negotiation using small stainless steel files. In this clinical study, after traditional straight line access was made, the patients were randomly assigned to one of the experimental groups, conventional hand file preparation or R25 reciproc preparation. In the conventional hand file techniques, 167 teeth included. Negotiation of the MB2 canals was performed using 25 mm files, size 6, 8, and 10. The pulp chamber was fluided with sodium hypochlorite to keep the canal lubricated. When the resistance was encountered and the files could not progress inside the canal, the instruments were pre-curved to reach the full working length. If the negotiation of the MB2 did not allow the file to reach the full working length, the negotiation was considered unsuccessful. In reciproc group, 174 teeth was used. The R25 instrument was used to pre-flare the canal space, advancing until it reached 2/3 of the working length. Then the working length is determined using K file size 10 or 15, hand file, and apex locator. If the hand instrument did not reach the working length, again R25 instrument is reintroduced in the canal, advancing more toward the apex. This procedure is repeated alternatively until the full working length could be achieved. When resistance blocking was encountered and the R25 instrument could not advance toward the apex, this tooth was recorded as unsuccessful negotiation. In the results, in group 1, hand files reached the full working length in 57% of cases. In group 2, the R25 instrument reached the full working length in 85% of cases. Their conclusion is that the reciprocating instrument play a positive role in scouting and negotiating MB2 canals, and the use of R25 instrument increased the effectiveness in scouting and negotiating MB2 canals from maxillary first and second molars. And the results of this study allow clinicians to become more confident in negotiating root canals using a simpler and efficient approach without a technically demanding hand file procedure.